Southern Maryland's morning show. T-Bone and Heather.
8 minutes after 8 o'clock, 8:08. Good morning, everybody. Welcome to the program and welcome back to the show. Dr. Larry Polsky, good morning, sir. How are you?
Good morning. I'm doing well. How about the two of you?
Good. We're doing well.
So far, so good. Last night I thought I had a fever. It turns out no, actually. I was quite chilled. We take our temperature. How often do you think we take our temperature?
I take my temperature about 9 times a minute.
I take my temperature about 3 times a day. I don't know if that's obsessive or not, but no, so far so good. And we're glad to hear you are healthy as well. So, all things Calvert County when it comes to COVID-19. Any good news, which is what we ask you every week?
Yeah, so actually, in the past week, there have been a few things that I think have been moving in a really good direction.
Oh, my. Hallelujah.
Yay!
What do you got?
So the governor has laid out 4 different parameters to start to open up businesses and schools and everything else. So the 4 things that he's laid out is that there is adequate testing capability, that we can trace contacts when somebody tests positive, that we can reach out to people who may have been exposed, have adequate personal protective equipment, and that hospital surge capacity. So if there is an uptick, significant uptick that needs intensive care, that is in place. 3 of those 4, I would say, over the past week, significant pieces have been put into place.
Excellent.
Yeah. So the one that I think is most lagging at this point is the personal protective equipment.
Yeah.
And hopefully, I know there's been a lot of work both on state level and on national level to improve that. So hopefully over the next few weeks, we'll see more equipment coming in.
Okay, let me ask you a couple questions now because I'm intrigued. Can you tell me, we have our hospitals in the Southern Maryland area, have we seen a surge? Has there been a surge, or have we been fortunate that we've been able to stay at capacity?
There has not been a surge, and I would hesitate to use the word fortunate because that makes it sound like it's just lucky. And I think that the measures have been put into place, as harsh as they've been, and they've been harsh. They have clearly had an effect in decreasing the transmission of the virus, and as a result, we haven't seen as many people become seriously ill.
Let me ask you this. How are you going to track people? When you say, if somebody comes in contact with somebody who maybe has had COVID-19, how are you going to let the public know, hey, this person was here at this time of day? How is that going to happen?
Yeah. So it's not so much letting the public know. It's and we've been doing contact tracing through our local health department and other local health departments across the state. And what we do is we reach out to the person who has the infection. We do a very detailed history with them as far as where they've been in situations where there is a likelihood of transmission, and then we reach out, and sometimes that's to workplaces and supervisors and coworkers. Sometimes it's family members. Each situation is a little bit different. The concern is that as the testing ramps up, we will have more and more people identified. Local health departments don't currently have enough staff, as the number of people identified may double or triple. And so what the state has been working on is contracting with a national agency that has a decades-long history of doing contact tracing. And so the scale of contact tracing will increase significantly, and that is necessary as the number of tests increase.
Okay, let's talk about that, the tests, because now apparently Maryland has 500,000 more tests. Who's going to be tested? How are we going to use up those 500,000? I mean, which is not enough, obviously, but it's maybe a nice little start.
Yes, I'd love to be really specific about that. I will say that plans are feverishly underway.
Feverishly underway.
Yeah,
good
so
call.
I almost hesitate to use that word, but anyway. So I think within the next 1 to 2 weeks that we'll have more details. I will say that before the governor's announcement came out, that there was coordination between our health department, the Maryland Department of Health, and our local hospital to increase local testing. So I can't give details right now, but I think probably the timing just didn't work out. Probably later today or tomorrow, we'll have more details in significantly increasing the capacity of testing in our region.
Oh, that's great.
The testing is it's interesting. I've had some callers, and I don't really know what the answer is. Here's a sentiment that I've heard from our callers, and I'll pass it along to you. So they say, okay, well, when you're talking about testing, what are you testing for? That's the first question. Mm-hmm. Are you testing to see if they've been exposed to the virus, or are you testing to see if they have antibodies? Because testing to see if they've been exposed to the virus, if I test clear on Wednesday, I could be exposed to the virus by Thursday by happenstance. So what is the point of testing?
So everything is trying to decrease the probability that someone will inadvertently transmit the virus to someone else. No one is expecting that we're going to have 100% eradication of the virus. And so what we're trying to do with testing is to increase the percentage of people, identifying the percentage of people who have the virus, so then they can take measures, their physicians can take measures to, number one, minimize the chance that they will inadvertently expose other people, and then identifying earlier in the disease process so that if there are treatments that are important for that person, that their doctors, nurse practitioners can start to manage their health at a stage prior to them getting very sick.
So it's not for antibodies. It's not for if you were asymptomatic and didn't even know you had it. Oh, by the way, you had it because of this test shows that you did. So it's not necessarily that.
Those are two different things, testing for the virus and testing for antibodies. As you've been alluding to, antibody testing is a retrospective. It tells you after the fact that you've had the virus. Most of the research at this point is showing that it takes about 10 to 12 days after someone becomes infected until they have sufficient antibodies that a test will pick that up. So this is not, antibody testing is not helping to manage disease. It's not going to prevent transmission.
Right.
Antibody testing will number one, to tell us the prevalence, just so we have an idea that if we see another increase in virus over the fall, what percentage of the population is still susceptible. It also will help identify maybe which frontline workers, whether they're EMTs, hospital workers, school nurses, who already have been exposed and are very, very unlikely to become sick again. So it helps to maybe prioritize who is safest to be on the front lines. The testing for the virus itself is a whole different game. That's where we're looking at trying to, again, prevent active transmission or to help safeguard that person's health so they don't end up severely ill.
Okay, but if they are tested and you have the coronavirus, you have COVID-19, are there different strains of that? Like the flu has different strains, and they hope that they will, with the shot that you get, the vaccination, that they hit on the right one for that season. I mean, even if you test positive, I mean, they're talking about 30 different strains now of this thing.
Is that what you're hearing? Because I'm hearing mixed things. So I've heard that there's 3 strains, and then there's other reports out there's 30 strains. What? I mean, if that's the case, honest to God, Dr. Polsky, I'm kidding you. I'm a team player, but if there's 30 strains, it's game over. We're done.
The word strain is a really loose word to use. And somebody told me yesterday you were talking about some research that showed 30 strains. Mm-hmm. But took a look at the article. What they are considering a strain in that article is if one nucleotide is different. So the coronavirus is genetically made of RNA. So all animals, all plants have DNA as their genetic structure. Viruses, some have DNA, like chickenpox. They tend to be pretty stable viruses. Others, like the flu and coronavirus, have RNA. We know that RNA viruses are less stable than DNA viruses. So the coronavirus has 30,000 nucleotides. Those are little building blocks that make up their RNA. In that study that had the 30 different quote-unquote strains, even if one of those nucleotides was different, they were considering it a different strain.
But so would a vaccine work? Let's say you had a vaccine for a strain. Would it work if there was one nucleotide different?
Almost certainly, yes. And
okay.
The vast majority of times when there is one nucleotide that shifts, it does not change anything about the way the virus behaves.
Oh, that's good news.
That's good news.
So there are some exceptions, but again,
well, let's just stick with that's good news.
But the vast majority of the time, it does not change anything. So at this point, the research that I'm seeing, and I will say that study was not peer-reviewed.
Stupid study.
Right.
and there's all sorts of behind, I won't get into all the
Sure, of course.
this, that, and the other. But at this point, from the most credible researchers who don't have a vested financial interest, anything like that, I have not seen any indication that the changes, the genetic alterations here and there, would compromise the ability of a single vaccine to work.
Okay, let me ask you this, Dr. Polsky. We got a call from a woman who said her sister-in-law, she called her up one day, she said to her sister-in-law, hey, what are you doing? And she says, I'm laundering money. Not for the mob, literally
washing
her paper currency in the washer.
Because she was worried that maybe, money gets handled by a lot of people.
So
she thought, I'm going to wash all my money.
Okay, so should people be washing their money?
I think that's going to a bit of an extreme.
Yeah.
Okay.
The potential that someone would get infected would be very, very low. I will say for somebody who, and we all have our quirks that makes us anxious, that if handling money makes people anxious, that for most people, they can use credit cards, debit cards, other sorts of ways that they don't even have to handle money. But no, I think that's going a little further than they need to.
Okay.
Well, I said, and I will continue to say, I will take any filthy money because I don't have any money. So bring your filthy money my way.
So you came up with some good news today, Dr. Polsky.
Look at you with the good news.
That's awesome. Well,
I'm really trying.
I know you are, and you're working so hard, and everybody there at the health department, they're doing a great job, and at the hospitals, and we thank you so much for being out there on the front lines.
Please do pass along our thanks to all the healthcare workers. It's I don't know if it goes unsaid, but it should be said more. We appreciate what you're doing.
Yes, we certainly
Just do it faster and better.
If I can take just an extra minute, because you brought up cleaning, and I saw a report earlier in the week that poison control centers are getting 2.5 times the number of calls, and these are related to cleaning products.
Oh, no.
Oh, yeah.
So just to caution everyone out there, we do want people to keep their homes clean, their workplaces clean, and this is at all age ranges. This is everywhere from infants all the way through adults. And what's happening is a combination of things. One is that people are combining different cleaning agents, and that oftentimes will release toxic fumes. So
yeah, it's not good.
No. And these cleaning fluids, by their nature, are volatile. So people should not mix different things. People have them maybe out on the counters more often, which means that kids can get to things. Mm-hmm. So just be very conscientious that after you're finished cleaning, put those back in a secured place so that little ones can't get to them. And regardless of who's around, again, don't mix cleaning agents.
Right.
Good idea.
All right. Well, listen, Doctor, we will chat with you again next week if you got a couple minutes, and it's always good to touch base with you.
It's a pleasure.
All right. Thank you, sir.
Be healthy.
All right.
Thanks,
take care.
Dr. Polsky. You too.
Yeah, it's I like to hear from the horse's mouth, as they say.
Okay, so I learned the hard way about not mixing chemicals.
Oh, yeah. Well,
okay,
yeah.
So this is what happened. So I was working on the pool one day, and I was going to shock it. So I had this old thing of shock, so I poured it in the bucket because I need to, get the granules. Then I had this brand new thing of shock, and I combined them. It was like a gas bomb went off in the backyard.
Seriously.
I swear, I thought I was I couldn't breathe.
Yeah, that's what they like.
I walked through this cloud of gas, and I grabbed my face, and my eyes started to water, and I was choking.
That's like what they would put into the trenches in World War I.
Yeah, don't.
Chlorine gas and all that kind of stuff.
Don't combine stuff.
Bad
oh, my
news,
gosh.
man.
Very bad news.
Hi, good morning. You're on with T-Bone and Heather.
Hey, I just had a couple questions because I wish he was still on. I caught that he stated something saying about if they're checking with EMS and doctors and nurses and everything that are around these patients, working on them a lot more, and we probably won't be getting reinfected. Well, if that's the case and we're around it more, how is it that somebody else isn't going to get reinfected? Because they're calling for this massive reinfection that they're trying to say in the fall.
Right.
But that's one. But here's another one. I know, and I've seen, and I've heard of different people talking about saying, oh, yeah, we were supposed to be quarantined, but I had to go shopping, go do this. They're not quarantining. They're going out and doing stuff. Mm-hmm. So how's that even effective?
Well, there's a lot of questions on the table there.
Sure.
Exactly.
I think what he was saying was these 500,000 tests that the governor got, it is going to go, to first responders and people working on the front lines and other people in the community to see if they have it. So in the fall, hopefully they will be immune and not get sick again.
Well, yeah,
exactly. So here's the thing. If EMS and everything are going to be immune to this and they're around it more, how come the general person wouldn't be in there calling for it?
Well, the only way they would be immune to it is if they got the virus and got over it.
Okay, on that, how is it that they're reporting that people who got reinfected are getting sicker in other countries?
Well, first of all, here's the thing.
I've heard that too, but I don't
exactly.
But
hold on.
I don't trust China. I
first
really
of all,
don't.
you got.
I don't trust anybody right now, to be honest with you.
Well, you can trust
because
me.
I am in healthcare.
Yeah, but
I've been dealing with this since day one, and I have not yet to be tested. Thankfully, we check our temperatures all the time, and I have not had any temperature or any other symptom.
Good.
But we still have not been tested.
Right.
But I personally also go get the flu shot, and I have never been sick.
Yeah.
So,
but here's the thing. You have to consider the source. First of all, I don't know of anybody who has confirmed had corona, COVID-19, got sick, got over it, and then got it again.
Exactly.
So I don't think people are getting reinfected, is what I'm saying.
Right.
Well, I mean, that's what they're claiming from other countries.
Well,
but they're again also saying that they're calling for it this fall that it's going to be even worse.
Well,
that's what the guy from the CDC said. But with all due respect to him and his many degrees, I'm sure in his many letters behind his name, he can't he can't tell the future.
And he was also speaking to the fact that, listen, what he was saying was there's going to be corona cases in the fall, but there's also going to be this big spike in flu cases, and it's going to be hard to tell which you have.
Right.
Or do you have the common flu, or do you have COVID-19?
Well, that's why there's a test for both of them.
Right, but you haven't been tested, right? You haven't been tested yet? And you're in healthcare. I would suggest maybe you call your local health department, and I would tell them, listen, I'm in healthcare. I know these new tests are coming down the pike at some point. How do I get tested as a healthcare provider to see if I've already had it or?
And I can tell you, I've worked one-on-one with confirmed positive cases.
Right. Well, then I would definitely, as a healthcare provider, I mean, you may have already had it and recovered from it and you didn't even know you had it.
Exactly.
So I would call the health department and see if they have a test for you, especially since you're on the front lines. And I would think that you would be a priority, at least give you a sense of relief in your mind and know that you can go out there and you're not going to be as susceptible.
Hang in there. Let us know how it turns out.
Thank you so much.
All right, listen, we're way behind. Listen, there's more questions than there are answers. I was glad to hear that when people say 30 strains, it's not 30 different mutations of the virus.
I'm so
because
glad
at that point,
that,
I said when that article came out yesterday, I went, "Oh, well, that's it. Game over. Game over, man."
I'm not going to take 30 vaccines.
Well, first of all, they'd never be able to create
No
30.
way.
They're still working on one. So
right.
They're not going to make 30. But when that came out, I was like, well, that's okay, then that's that. But that was good that he said, no, one little whatever the hell he said, it doesn't make any difference.
Nucleotide.
The vaccine, there you go.
Is that
the
what it
vaccine,
was?
I don't know. The vaccine will still work.
Right.
And that's good news. Here's what you should do, people in charge. Get us a vaccine.
They're working on it.
I know, work harder, work faster. Take every machine in the world and connect them, and let's just do this.
Yeah, get Big Blue going and Watson.
Fire everything up, everything immediately. Run the calculations.
It's like Gary Oldman in The Professional.
Everything.
Everyone.
And here's the other part of it. Stop being so safe.
Right.
If you get like a 98% success, then put it out.
Oh, they would, I think, if it were 98%.
I don't know about that.
Condoms are only, 73%?
Well,
and they're always saying use those.
You would know. All right, let's say, that's not right.
Southern